Well, thanks. Yep. My name's Ben Pascoe, and I'm based here in Oxford. I'm going to be talking about using AI to try and predict AMR resistance from genotype data, from genomic data. And I'm going to use Acinetobacter baumannii as the example, and this is a really good organism to choose as our model because it's a global problem, and I've spotted it a few times today on people's slides. It's on the WHO priority pathogen list, and because of that, it's included in these genomic epidemiology studies. So there's lots of publicly available genomes, and in the map was just what I looked for last night. There's nearly 24,000 publicly available Acinetobacter baumannii genomes, and unlike the Barnard study that we heard about this morning, many of these don't include clinical phenotype data as well as the genomes. So many people are trying to predict resistance from genomic data, and that's what we see in this plot, is predictions of resistance. And carbapenem resistance in particular is rising in Acinetobacter as it becomes used more often. And so often this genotype data is a poor reflection of the phenotype because it's not a single gene that confers resistance. So we miss a lot of what's going on in carbapenem-resistant Acinetobacter because there's many different mechanisms to which you can achieve resistance. So we've heard about plasmids today, so you can acquire a gene on a plasmid that goes into the chromosome. There might be SNPs in efflux pumps or porins that alter the permeability across the membranes. And there might be other changes within the genome that alter transcription or even things that we don't yet know about. So this makes prediction of AMR resistance, and in particular the MRC values, very difficult for genome data in Acinetobacter for carbapenem resistance. So can we use machine learning, can we use AI to try and bridge that gap between what we're currently doing, which is just looking in databases, and what we might like to have a better understanding of the resistance that's actually in these isolates? And our approach is to take what we know already, so we use MIC readings from the lab and phenotype data, we combine that with our simple identification of AMR determinants using databases, and we feed that into an ML model, an AI model, and it is XGBoost, but don't ask me about it either, to make predictions in our collection. And then to try and build on that, we refine these predictions by doing genome-wide association studies with the phenotype data to see what else in the genome is also associated with resistance, to sort of refine our models in an iterative way. And any model is only as good as your training data, and in this example we have a training data set of about 300 genomes that were collected over a 20-year period in Russia and Eastern Europe. And during that time, carbapenem resistance increased sharply, so we have a good mix of susceptible and resistant isolates, and they were collected over multiple hospitals and different health centers. And when we do our conventional look for AMR determinants, this is a complex heat map, but we've got different antimicrobials in each row, and the AMR determinants are in each column, and it's not a simple correlation between one gene equals phenotype. You see that some determinants confer resistance across multiple different antibiotic classes, and we don't see sort of one red line in each antibiotic. It's a polygenic phenotype. And then we can use our machine learning to improve this prediction, to take all of this information into account, and then we can look in a validation data set to make sure it's not just a function of our training data. So we use an external data set that has been put together by Broncio, Duncan, and Anthony as an IOI collection. So this is a different set of isolates that also have phenotype and genotype data. And we move from sort of a low correlation to something where we can predict more than half of the isolates within one dilution on an MIC phenotype that we see on an e-test strip. So where does that remaining information come from? We do these GWAS, and this is the part of the work that's ongoing now, so we can look within the rest of the genome and see what other features in the genome are associated with resistance, and straight away we find these multiple mechanisms where maybe it's on the Maybe there's a carbapenemase gene on a plasmid that comes into the isolate that needs a SNP in the core genome to be able to maintain presence of the plasmid or express the protein that's coming in. And we see these different mechanisms, and we add that information into our model to try and improve things, and that's what we're doing now. So finally, here's a quick one. My take-home message is carbapenem resistance is complex in Acinetobacter. Resistance is polygenic and involves a lot of different genomic features, not just AMR determinants that we have in databases that we do our routine checks with. ML prediction improves this beyond these simple correlations, but also there's unresolved biology that we need to continue exploring to try and improve these methods. And then finally, I'd just like to thank the wider group here in Oxford, particularly Sam, Lily, Duncan, Broncio and Anthony, who built these IOI collections on the IOI hub, and then external collaborators like Mikhail, who put together this collection over 20 years. Evangelos was a former postdoc in the group who did some of the GWAS work, and then Matt, who's done all of our sequencing. And I'm happy to take questions.